Hey class. So for our meeting today, we're gonna have the discussion on activity 2, which would tackle about specimen collection and specimen handling. So as medical technologists who work in the laboratory, it's very important that you know how to analyze or identify properly collected samples and how you would handle them and process them accordingly. So if you're unable to process them accordingly, or if you accept samples that are not or are improperly collected, this may cause problems in your result. So imagine collecting a 1 ml of urine for urinalysis. So that's supposedly rejected. Bawal yun. Now this is a table class of the different specimen, the patient preparation, then what are the containers, and the required minimum quantity. So I won't go through them all. I'm just gonna choose some. So specifically, let's start with blood culture. Now, when you collect blood culture or blood for blood culture, you have to first disinfect with the skin with alcohol and iodine or chlorhexidine before any puncture. So this was explained class before in your activity 1 that whenever you would collect a sample for blood culture, you need to clean it also with iodine or in some cases chlorhexidine. And then the container are usually aerobic or anaerobic culture bottles or an SPS vacuitainer. 20 ml class if it's an adult and 5 to 10 ml if it's a child. And then for hair, nails, and skin, hair would usually be, you're going to have 10 to 12 hairs per shaft. So, ganun kadami class. The nails would be for the clip area. So, yung mahabang na clip na area. Then, the skin, for skin, you need to take the sample from the edge of the lesion. So, kung ito yung sugat class, you collect here, dito sa edge ng lesion. Then, you're gonna use a clean screw cap container. So this is the entire list. So I want you all to memorize this class. This will definitely come out in your upcoming quiz and exam. Now, that are the basic principles of specimen collection. So it's very important class that you are able to accurately, timely, and aseptically collect samples. So it has to be accurate, it has to be on time, and it has to be free from contamination or it should be clean. The goal is to prevent any contamination and ensure optimal condition for organism recovery and accurate diagnosis. Now, the general principles would include number one, collect the specimen before antimicrobial therapy begins. So, if you're gonna test or if you're gonna grow bacteria class, you have to collect it before the patient starts taking antibiotics. We have what we call kasi a baseline sample. Now, when you say baseline sample, this is the start or the start sample or the first sample. Usually, class, in a baseline sample, the patient has not yet taken any form of antibiotic. And remember, antibiotics would kill the bacteria. So it's very important that before the patient could even start would even start taking antibiotic, you have already collected the sample to prevent any erroneous result. Then use the appropriate container with correct transport medium. So imagine if you're gonna be collecting urine sample class for urine CS, ang binigay sa ng patient is on a glass jar container. So you have to reject that class kasi it could contaminate the sample. Then, the third rule class. So, ito ang pinaka ng kasalanan ng medtech is mislabeling. So, it's the greatest sin of all medtechs class and even in healthcare profession. So, as medical technologists, you need to make sure that all of your samples are labeled properly with patient and then identifiers and source. Delivered to the laboratory promptly within the recommended time frame. So if the sample is collected class at 1 p.m., it has to be in the laboratory within an hour. Nangyayari ito class, you will encounter this pag nag-work na kayo sa lab in the future or even as interns wherein the sample was collected at 10 p.m., dumating yung sample sa'yo 6 a.m. So you need to assess yourself if i-accept mo siya or hindi. Then avoid contamination from skin flora or other body sites. So that's why it's very important nga to practice aseptic technique, which we will be discussing in the future topics or activities. Then follow institution-specific protocols and biosafety precautions. So your institution, your laboratory will set up guidelines, class. Itong mga guidelines na to, you have to follow. An example of this, if a patient has the biohazard symbol for tuberculosis, may coughing symbol dun, you have to wear masks when visiting or collecting sample from that patient. Now, let's talk about some of the samples that are collected. Ano yung mga guidelines? Let's start with urine sample collection. Now, when the patient collects urine sample, the ideal sample is always the midstream clean catch. Now, you would collect some urine sample class for culture and sensitivity. The first thing you need to do is to remind the patient or inform the patient to cleanse external genitalia. Paghugasin niyo yung pasyente ng external genitalia niya, begin voiding and discard the first part of the urine stream. Midstream portion is collected in a sterile screw cap container or urine transport kit, 2 to 3 ml minimum. Avoid contamination with skin flora or hands. Transport to the lab within 2 hours or refrigerate at 2 to 8 degrees if delayed. Used for diagnosing urinary tract infection. So most of the time, class, kapag nag-collect ang patient for bacteriology ang sample urine, most likely may UTI yan. Visually pa lang, class, you will have an idea if a patient has urinary tract infection. Paano? How? You could identify the urine if it has UTI in some cases or in majority of cases if the urine is turbid. Kapag ang ihi ng pasyente sobrang turbid, sobrang labo, the most likely case is that the patient is suffering from urinary tract infection. Now, they would use this for bacterial culture. Now, first void specimens may be requested for Chlamydia trachomatis class or Neisseria gonorrhea nucleic acid amplification tests, while the midstream is referred for culture. So, kung first void sample, yung first part class is usually used for Chlamydia trachomatis. Si Chlamydia trachomatis kasi is known to cause a disease or a lesion known as your trachoma. Now, itong trachoma na to, itong lesion na to, usually found to sa genital area. So, pag dumaan yung ihi, yung first part ng ihi, makukuha niya yung bacteria. Makukuha niya yung Chlamydia trachomatis na yun. So, ideal that you would collect the first void part. And you could also do this for molecular tests, yung nuclear amplification test, acid amplification test for Neisseria. But again, for culture, midstream clean catch ang ideal. Now, for the specimen collection, we have your lower respiratory tract secretion. So, for collecting samples such as your sputum, pag lower respiratory tract class, we're talking about the sputum. Pag upper respiratory tract, we're talking here about the saliva. So, salivary samples. So, pag lower, sputum. Pag upper, more on the salivary part. Now, when you collect sputum samples or samples from the lower respiratory tract, have the patient rinse mouth or gargle with water to minimize oral contamination. Kasi sa bibig natin, class, we already have bacteria present, specifically yung normal flora natin. When we have this normal flora in our mouth, this could contaminate our sample. So, ipag-rinse nyo yung pasyente, then instruct the patient to cough deeply. So, sasabihin nyo sa pasyente, huminga po kayo ng malalim. Sa paghinga, saka kayo umubo. Then collect 1 to 2 ml of sputum in a sterile screw cap container. It has to be sterile class. Ensure the specimen is not just saliva. Examine for color and viscosity. Is the sample mucoid? Is it the sample purulent? Yung sobrang greenish class. If naman water yan or salivary, you have to reject that class. Hindi pwedeng laway, dapat sputum. Then it is used for detecting organism causing pneumonia, tuberculosis, fungal infections, etc. Then you have to reject this if it is predominantly salivary. So yun nga yung sabi ko, if the sample is salivary class, you have to reject that. Our target here is lower respiratory tract, not the upper respiratory tract. Now, let's talk about stool naman. Now, you would test stool for bacterial, parasitic, and most important, viral analysis. There are certain viruses class that would cause diarrhea in children. That's why they would use stool samples. So you would instruct the patient to defecate into a clean, dry container, not into the toilet or with urine. I have encountered class patients collecting or defecating in ice cream tubs. So nilalagay nila class sa lagayan ng ice cream yung stool nila, and they would bring it into the lab. You're going to ask the patient only a small amount class. Hindi mo sasabihin dun sa patient, collect your entire school, ang dami nun. Your entire stool, ang dami nun. You just have to collect a very small amount, kahit nga lang pea size. It doesn't have to be super big. Then transfer a portion into a clean leak-proof container, 5 to 10 grams. So kung hindi 5 to 10 grams, pea size class is enough for fecalysis. Then if testing is delayed beyond 1 hour, place in a transport medium such as your Kerry Blair. Avoid contamination with urine or water. So i-reject nyo. You have to reject stool that have been scooped out of the toilet. Bawal yon because it is already contaminated with water from the toilet or urine from the toilet. Used for detecting enteric pathogens class such as your Salmonella, Shigella, Campylobacter, Clostridium difficile. Use preservatives class if parasites are suspected, such as your formalin and your PVA. Now, let's talk about labeling and requisitioning. When we talk about requisitioning class, we're talking here about the request form. So there are steps in identifying, or you need to take note of the following to ensure accuracy and traceability. Pag sinabi mong traceability, you want to know who made the mistake. Ikaw ba? Yung nurse ba? Yung doktor ba? So you need to make sure that every time you would have your specimen collected, it has to be labeled at the bedside or point of collection. Bakit bedside? You have to label it bedside class because you want to validate the identity of your patient. So kung katabi mo yung pasyente, meron yung name tag. Itanong mo yung pasyente, kayo po ba to? Ano pong pangalan nyo? Ipa-identify nyo yung hospital ID number, check for label sa pasyente. Then when you collect them, you label it, and the label class should include the following: the date and time of collection, the type and source of specimen, initials or the code of the collection. Also, don't forget the name of the patient sa label. Then the accompanying specimen should have a request form. Yung request form class should have the following: ang patient information, name, date of birth, ID number sa hospital, ordering physician, type and source of specimen, anong klaseng sample yan, saan kinolek, clinical diagnosis or suspicion, what is the possible diagnosis. Does the patient have tuberculosis? Does the patient have cancer, pneumonia? The patient is suffering from anemia? Then what are the requested tests? So as medtech class, dun pa lang i-check nyo na kung ano yung test na nire-request. If the doctor is asking for prothrombin time, tapos ang kinolek mong container is EDTA or yung violet top, patay ka. It's already rejected. So you need to make sure that you have to collect the proper container for the sample. Then take note of the collection time and date and collector's name. So anong oras mo kinolek, ilalagay mo yun sa request form. Ilalagay mo rin yung pangalan mo. Kahit yung initials mo class, kahit yung last name, then initial ng first name. Any relevant patient preparation or antibiotic therapy. So kung yung mga tests nyo class are considered special tests, katulad ng mga tests for hormones, the patient would have to prepare. So dapat naka-include din yun sa request. So doon pa lang dapat ninonote na ng doctor or ninonote na ng nurse bago nyo i-accept. Improper or incomplete labeling can lead to specimen rejection, potentially delaying diagnosis and treatment. Now let's talk about preservation and storage class. So very important to maintain bacterial or microbial viability. So gusto mo na mabubuhay, let's say ang request is culture. Pag culture class, you want to propagate the bacteria. And it's very important that if in cases that there are delays in transport, you could preserve their viability, yung ability nila mabuhay class. Now, specimens class in most situation are ideally transported within 30 minutes of collection. So, dapat within 30 minutes, nasa iyo na yan. If immediate processing is not possible, follow storage guidelines. Ano yung mga storage guidelines na yan? Ito yan. So, there are different storage guidelines class. Pag urine, 2 to 8 degrees. Halimbawa, ang sample mo for blood culture, for urine culture, na delay, 2 to 8 degrees if refrigerated. Pag stool naman, 2 to 8 degrees. Pag blood, for blood culture, room temp lang. Pag stool for ova and parasite, preserve at room temp. Pag mga respiratory specimen such as sputum, 2 to 8 degrees centigrade. CSF class, yung cerebrospinal fluid nyo, room temperature lang. Swabs, throat and wound swabs, 2 to 8 degrees. And tissue or biopsy in a moist, sterile container at 2 to 8 degrees centigrade. Usually, gumagamit lang ng NSS dyan. So the container would contain NSS, a small amount, para maging moist yung container, maging moist yung tissue. Then store na sa rep. So these are the different specimen storage guidelines class. Paki-memorize ito. Then avoid extreme temperature fluctuations or exposure to heat or light unless specified. Most specimens should be transported in a leak-proof container that is sterile with secondary containment. Now, what are the different preservatives? So, you would use polyvinyl alcohol or PVA and formalin for stool specimens for ova and parasite analysis. Boric acid naman class in urine collection containers to maintain bacterial population during delayed transport. Then carry Blair medium naman for enteric pathogen preservation in stool samples. Buffered glycol saline for viral specimen. Each preservative is chosen based on the organism of interest and test method. So take note of the different preservatives class. Then let's talk about the anticoagulants. So they would also maintain suitability of the sample. So we have your SPS. So familiar kayo dito class. This is for blood culture. It inhibits complement and some antimicrobial agent. EDTA used for molecular diagnostics and parasitic exam. Heparin occasionally used for viral culture. And if you're unable to properly use this class, it would lead to false negative results. Take note of that. Then there are also transport mediums. So whenever there would be delay in processing, you would use this class. So we have your Stewart's or Amy's medium used for swabs class. So mga throat swabs, wound swabs. For Kerry Blair, ideal for enteric pathogen. VTM, yung viral transport medium used for respiratory or viral sample. Anaerobic transport medium maintains strict anaerobes from oxygen exposure. Example are sealed tubes or jars. Now let's go to shipping infectious substances. So very strict ang WHO dito class, ang CDC and etc. So this is being regulated class by the US Department of Transportation and International IATA guidelines. So this is an international guideline class that all countries need to follow when transporting infectious material. So whenever magpapadala ka ng infectious material via plane, via boat, via ship, you need to follow this standard. Now, if you're transporting category A samples, ano ba itong mga category A samples na to? Itong mga category A na samples na to, class, they are known to cause permanent disability or are life-threatening, such as your Bacillus anthracis. Kasi si anthracis nyo can cause anthrax. Pag na-inhale mo yan, if you inhale the powder or the form of anthrax powder glass, you could easily die. And then you have your Mycobacterium tuberculosis, which is known to cause TB. So for category A, you need to ship them in a triple packaging with a diamond-shaped hazard label UN 28104, 2814, or UN 22900. Now, for category B, not generally capable of causing serious disease. Routine clinical specimen. Labeled as UN 3373. So, among the two, mas deadly ang A compared sa B class. Now, ano ba yung triple packaging na sinasabi that you need to follow for category A? In triple packaging, you're going to use three types of container. A primary, a secondary, and an outer. Now, yung primary container nyo dyan should be a watertight container. Usually, class, mga tubes yan. So, if you take a look at the picture, ito yung infectious substance mo. Inside the infectious substance, there would be absorbent packing materials. And it is covered by a watertight primary receptacle. So, ito yung primary container mo. Your primary receptacle class could be glass, could be metal, or plastic. So, pag nalagay mo na yung sample dun sa primary receptacle mo, you now place it in a second container. Now, the second container should be watertight container with absorbent material. So, ito naman yung watertight container mo. Itong garapon na yan. Yung big container na yan. So, you would place it inside. Then, there has to be labels inside as well, class. What are the list of the contents? Anong laman? Something like that. Then we have the rigid outer packaging. The rigid outer packaging should have an infectious substance label, a proper shipping name and UN number. Ano yung UN number? Ito yan, UN 28114, UN 2900. Then there has to be the UN package certification mark, shipper or consignee identification. So those are the things that you need to take note. So this requires proper training, class. May training to 2 days if you want to know how to properly package infectious substances. So in the future, hopefully matry nyo to or ma-practice nyo. Now, what are the specimen receipt and processing? So when you receive your samples class, you need to take note. So medtech, as medtech, ito trabaho natin class. Patient identification, at least two identifiers, yung name, yung ID number, anong specimen type. Mamaya yung specimen type nyo pala class, naka-label doon, sputum. Pero yun pala, pagtingin nyo sa loob, urine pala siya. So you have to double check. Then it has to include the date and time of collection, the appropriate volume and condition, walang leaks, nasa correct temperature. So kung yung sample should be transported in room temp, dapat room temp yan, hindi malamig. All specimens are handled as potentially infectious and are processed in a class 2 by a safety cabinet when appropriate. Then specimen priorities. Specimens are prioritized based on urgency and pathogen survival. Examples are STAT or critical. So usually used for CSF, blood cultures for suspected sepsis, tissue from sterile site. Then routine samples such as your urine, sputum, wound swabs. Then low priority samples, stool for parasites, environmental swab. So ito mga specimen priority na to class. Ito yung mga how you would or kung ano or what samples would you process first. Ang priority mo dyan among them all are usually CSF samples. They need to be processed ASAP, followed by the routine, and lastly are the low priority, which are usually yung mga stool and environmental swabs. These are the levels of specimen prioritization. So level 1 are usually CSF and tissue body fluids. They have high risk and low survival of organism. Level 2 are blood culture, sterile site aspirates, time sensitive. Level 3 urine, respiratory wound culture, stable organism, but clinically significant. Level 4 stool for parasite, surveillance, or environmental, not urgent or directly linked to patient outcome. Then what are the unacceptable or samples or specimen rejection criteria? So you can reject samples class on the following basis. If the container is leaking or broken, improperly labeled or missing label, wrong specimen container, improper storage, insufficient volume, dried out swabs or desiccated samples. Then, when observing the samples, take note of the following: a macroscopic and microscopic. For macroscopic class, the volume is the amount sufficient, is the color, take note of the color, take note of the turbidity or presence of visible contaminant. Then what are the viscosity and consistency? Is it mucoid, salivary, mucosalivary, or form or watery sa stool? Then you're also going to do microscopic observation. You're going to do direct gram stain or acid fast stain on samples such as sputum, CSF, and wound swab. Then you're going to identify host cellular response. Does the sample contain WBCs, epithelial cells, in sputum sample? So kung mas madami class, pakitandaan ito. If your sputum sample or your respiratory sample has more squamous epithelial cells, most likely salivary yan. It has to have more WBCs to be considered sputum. So, yan ang isa sa mga ginagamit nilang criteria. Then you need to check for organism. Are there bacteria, fungi, or parasites? Now, let's talk about inoculation. So, when we talk about inoculation, you're placing or you're plating samples on a culture media. So, you will learn more about this class in the midterm, but bibigyan ko na kayo ng idea about inoculation. So, inoculation is basically putting your samples in a media plate so that you could collect or identify the bacteria. It is done, class, to isolate the pathogen from normal flora. allow for accurate identification and susceptibility testing. Now, there is a method known as your four-quadrant streak method. This is the most common for streaking solid media. So, kung ito yung plate nyo, using an inoculating loop. Ang itsura ng inoculating loop nyo, your inoculating loop looks like this. This is a wooden handle. Then there's a metal here, then a circular loop. So using the inoculating loop class, magi-streak ka. When you streak your sample, not too hard, so that's one quadrant. Then you stop. Then you continue to the second quadrant. You stop. Go to the third quadrant. You stop, and then go to the last quadrant. So that's the four quadrant streak. It's the most commonly done. For liquid media, however, proper aliquoting is necessary. Inoculation must be done in a biosafety cabinet with appropriate PPE and sterilization of instruments after each usage. Then these are the different types of culture media. So I'm going to go through them, class. Pag non-selective, what you need to remember here is non-selective siya, meaning it is meant for all. It does not uh, it does not select or discriminate against other bacteria. It grows every type of bacteria. It includes the blood agar media and the chocolate agar media. For selective media naman, class, it would suppress normal flora to allow growth of pathogens. So specific siya, class, or it would grow only select organisms such as your McConkey for gram negative and CNA for gram positive. Then we have your differential media used to differentiate organism by colony, air morphology, or color change. Ang pinaka-best example dito, class, is when growing Salmonella and Shigella. So would tend to have differentiating colors if you grow them in a differential media. Examples of these are McConkey for lactose versus non-lactose for fermenter and XLD. Then we have your enriched media which would support fastidious organism. Pag sinabi mong fastidious, class, they are slow growing. Matagal sila tumubo. They grow at a very slow pace. Example of this is chocolate agar media for Haemophilus and Neisseria. Then we have your anaerobic media for anaerobes. CDC, anaerobic blood agar, LKV agar. Then specialty media for specific organism such as your BCYE for the bacteria Legionella, Thayer Martin class for Neisseria gonorrhea. Now you would you would select your media class depending on the following: specimen site, suspected pathogen, presence of normal flora, or the need for enrichment or differential capability. So you will understand this more, class, or you will be applying this in practical applications in the midterms. But do take note of them. So you would select your media based on specimen site, suspected pathogen, presence of normal flora, and need for enrichment or differential capability. Then specimen preparation, class. So when you need to take note of proper specimen preparation. So if you're going to collect swabs, tissues or swabs, it may require grinding or emulsification in sterile saline. Usually, class, sa laboratory, pag dumating ang mga tissue samples nyo, they come in very large sizes. So you may need to grind it first or emulsify it in sterile saline so that it would soften and easier to process. Then you need to also process blood samples like SPS, placed in blood culture bottles. Then for respiratory samples, you need to do digestion and decontamination. So to do that, you need to apply what we call sodium hydroxide This is for decontamination. For digestion naman class, we have your so-called NALC or yung N-acetyl L-cysteine. So they are both used for decontamination and digestion. They reduce overgrowth of commensals and allow detection of pathogens such as Mycobacterium tuberculosis. Kasi ang sputum samples to class, they have a lot of normal flora. They have what we call commensal bacteria. So you need to remove them. You need to make sure that your sputum is also properly digested. Kasi in most cases, sputum is highly purulent. Mahirap siyang i-process or i-set free yung bacteria. Kasi nga purulent siya, they tend to stick, so you have to digest it using NaLC. Then let's talk about isolation technique. So sa isolation technique class, it is used to obtain pure culture. So let's say you only want to collect or you only want to grow Staph aureus. You want only Staph aureus, but in your plate, there are other organisms. May Neisseria, may Haemophilus. So you need to apply isolation technique. So you could do this by the strict plate method. Sa strict plate method class, di ba, apat na quadrant yon. Apat na quadrant. Let's say dito sa first quadrant, may white, may blue, may red, may yellow colonies. Sa second quadrant, may white, blue, and yellow na lang. Sa third quadrant, blue and yellow na lang. Sa last quadrant, blue colonies na lang. And as per knowledge, if ever, kunwari lang class, just to give an example, blue colonies yung natira, let's say that is S. aureus. So you could do that. By doing a four quadrant streaking, mas dinidilute mo yung dami ng bacteria per quadrant. The last quadrant would usually have the purest organism. Then we also have your quantitative plating, usually used for urine. You would use calibrated loops to quantify CFUs. Then enrichment culture, used for specimens where the pathogen is outnumbered by normal flora. Then selective and differential media such as your McConkey agar, CNA, and Thayer Martin are used to enhance or suppress growth of specific organism depending on their biochemical traits. Then take note of the incubation class. So you need to incubate the organism in optimal condition. So there are certain incubation things that you need to take note of class. For aerobic incubation, it has to be set at 35 to 37 degrees centigrade in ambient air or carbon dioxide used for most pathogen. So when you incubate bacteria class, the usual routine temperature is 35 to 37. For anaerobic incubation naman class, usually used for strict anaerobe such as your Clostridium, you need to use anaerobic jars or chamber. For microaerophilic incubation such as your Campylobacter jejuni and Helicobacter pylori, it would require reduced oxygen. Then for temperature variation such as your Yersinia enterocolitica, it would usually grow at 25 to 30 degrees. Fungi like Histoplasma capsulatum requires 25 degrees for mold phase and 35 degrees for yeast phase. Then this is the isolation of unusual or fastidious bacteria. So some bacteria class, to give you an example, Legionella pneumophila would require buffered charcoal yeast extract agar, which contains L-cysteine. So they require different medias class such as your MTB, which would use LJ media. Takes 3 to 6 weeks to grow. So kindly memorize this table as well as they may come out in your quiz or exam. So this is the reference used in this presentation. So that ends class the activity 2. Thank you.